Alrighty, hey y'all, it's Stacy Pace again with Spectrum the Other Clinic, back with another episode of whatever it is I'm doing here, just trying to provide some education. The question that I have been getting over and over, and I'm finally doing a video, is can bone structure be changed by hormone therapy? This is most commonly asked of me by trans feminine individuals, although some masculine individuals do ask me as well. But anyway, so the question boils down to, when you get on estrogen or testosterone therapy, are you going to have significant changes to your bone structure that would then masculinize or feminize you? The short answer to this is going to be no. That is unfortunately wishful thinking, because when you look at human development, what happens with the plates, the growth plates in the bones, is they close off at a very early age. For those who are, cisgender girls, that's going to be the ages of between 13 to 15. Those bone plates stop growing. And then on those who are cisgender male, that's going to be somewhere between the age of 15 and 17. Now, if you start hormone therapy before then, there is a good chance that you can alter bone structure. But anything after the age of 17, 18-ish, you're not going to have any kind of bone structure changes. Now, that being said, that's not to say that you cannot have structural changes to other things that can cause the appearance of bone structure changes. And I think that that's where this misconception comes from, because some folks will see that, the hips on some trans feminine individuals, flare out a little bit, or they'll see the face structure looks like it's changed, be it masculine or feminine. And what you're actually seeing is more than likely going to be fat redistribution. And what that means is basically the fat in your body is going to pack up and move along to a more masculine or feminine body pattern. A lot of times you'll notice that more masculine type individuals are going to have fat mobilization more towards the front middle section, whereas the feminine individuals are going to have, of course, up on the chest, but also towards like the hip thigh area and butt. But anyways, so you'll see fat redistribution. And one other thing though that gets discounted a lot is that you can see some muscle pattern differences, because if you go on masculinizing hormones, you're going to gain up to 25-30% of muscle mass, depending on the individual. And the reverse is true on feminine individuals. You will lose up to 25 to 30% of muscle mass over time. And so these can cause drastic changes in your body appearance. There are also some tendon and ligament changes, lengthening and shortening that can happen, that can change your way that your vertebral column sits, meaning your back, and like how the curve in your back does. You can see the distance in the joints of your hands and feet change based on the thickness of the cartilage that's present. And then also, I'm going to try and put up a picture if I can figure out how to do it with this photo editing software that I've got now. But anyway, essentially, this is a picture of the human skull and some of the muscles and fat pads underneath. So here's the thing with fat pads. Fat pads are different than just regular old fat. Like this is fat. This is just fatty cheeks. But fat pads actually would cling to bone, and they're like kind of compact fatty tissue, so it can become very hard and firm, kind of like cartilage. If you've ever been eating a chicken wing and you get that little yellowy kind of, you can't chew it, it's just hard, chewy type thing, kind of like that basically, only it's a compact piece of fat that's stuck on, say, your jawline. And this fat pad can have a lot to do with how your jawline appears, because if it swells out, it gets fatter, then of course you can have like a more angular jaw or a rounder jawline. Same thing with the chin and everything. You can see on this this model of the human skull and everything that there are fat pads literally everywhere. Like they're all over the place. So they can gain size, shrink in size and whatnot, and alter the appearance of your face. These things are also located all over your body, all these different fat pads, so they can change in size and shape and everything during hormone therapy. And this is going to be, like I said, a large part of where you see these changes that appear to be bony structure changes. It's actually either like fat pad changes or ligament, tendon, or muscular changes. Rather than actual bony structure changes, because like I said, the bone growth plates fuse sometime around in the early teenage years there, around like 13 to 15 for cis girls, 15 to 17 for cis guys, and once those suckers are closed, you're pretty much screwed for bone changes, except for the age-related kind over time. But anyways, so just to recap, the structural changes that are physically apparent to the naked eye that occur in trans folks are going to be more due to fat pads shrinking or gaining size, actual just fatty fat, like the cheeks or the belly or whatever, redistributing how they are spread out over the body. They could be ligament or tendon changes, lengthening or shortening of those. And then musculature changes in how much mass of muscle mass that you have in your body, either gaining on testosterone therapy or losing on estrogen therapy. I hope that kind of cleared things up. Like I said, I mean, I think there's a lot of folks out there kind of purporting that this is something that does happen with people, that it's actual bony structure changes. I have never seen any research that said that this is true for those who have completed their initial puberty, you know, they're over the age of 18. I've only seen, like I mentioned, those things causing these changes. There are studies out there, though, on folks who go on hormone blockers during their teenage or, you know, early puberty years and then go on hormone therapy. There is evidence that they have bony changes, but to my knowledge, at least right now, I haven't been able to find anything showing bony structure changes to those over 18. Anyways, hope this helped, and write to me with your questions if you had any. Bye!